Hi, I'm Kurt Egerbrecht. I'm the health officer for the city of Appleton, and I appreciate these question and answer periods that we've been able to share together. Well, with many diseases, COVID-19 being one of them, there's often a stigma attached to when you have a disease, and often that lasts longer than the disease itself. So that's one of the mental health conditions we find with communicable diseases all the time. I think what's also unique with COVID-19 is there's so many unknowns because this is a novel virus. So we don't, for example, know where a school's going to be in the fall. Where is my job going to be? Is this economy going to be impacting me? It's those unknown fears that can often build up in terms of people's stress levels. So we recognize that. We recognize that there's stress in the community that this virus is creating, not just here in Appleton, but really across the globe. These are universal feelings that people are experiencing because it is a new and novel virus. I think if people are noticing stress-related symptoms within family members or friends, I think reaching out for help is really important. There's many helplines that people can reach out to within the community, and anticipating and reaching out at a time of need is really a sign of strength. So I encourage people to do so. There may even be households where there's a diversion in terms of agreement on the virus. Some family members may feel this is not anything to worry about, and others could be extremely concerned about it. And I think accepting that is normal. We all internalize differently data that we take in. And so recognizing that family units could have diverging thoughts and ideas on this, and discussing that and discussing why you believe the way you do in a civil manner is really important. Without having good communication within the house, we can lead to additional anxiety and stress within that family unit. And that's what we want to avoid. Good question. So takeout food is a relatively low risk because that food has been prepared in a commercial grade kitchen. You're getting food that the preparers know the food codes and prepare it in a way that's safe for you to consume. So that would be a low risk carryout and a great option for people to support local businesses. So the packaging that your carryout food, you might choose to, after opening it, dispose of it properly and wash your hands before consuming your meal. Just like any hard surface, if there was a virus that was present at the time, that those virus particles could have gone on the outer packaging, whether you're in a grocery store or a restaurant. So again, opening the package, washing your food and your hands prior to consumption is your best and safest way. Yeah, public bathrooms actually do pose a higher risk, and that's why the increased sanitation, washing your hands after using a public restroom is very critical. If you don't have soap and water, the hand sanitizer is a good way. So any high touch point, especially that the general public has been using, it's a good idea to increase sanitation of your hygiene of your hands and washing afterwards. Yeah, it's a relatively low risk, but it has been documented that humans can transfer the virus to pets. So that's why it's suggested if you are COVID positive that you don't have close contact with your pets during the time that you're recovering. We don't have evidence, however, that pets can then transfer it to humans. So it's really the risk to the pet itself, and separating yourself from your pet just as you would a household member is important at the time you're getting better.